Servus and hello from Bavaria. My name is Thorsten Ludwig. I am the founder and owner of Sole Runner, the barefoot shoe brand from Germany, and I welcome you to this podcast. We develop our Sole Runner barefoot shoes in Bavaria, near the beautiful Ammersee. Today I want to talk about a topic that affects many people, vein problems, and whether barefoot shoes can help. Many people know the feeling of heavy legs, swollen ankles or visible veins. So the question quickly comes up, can barefoot shoes improve this? Barefoot shoes are not a medical treatment for vein disease, but they can be a meaningful part of a more active and natural everyday life, especially if they help you use your feet more consciously, walk more, and activate your calf muscles. Because movement is extremely important for your veins. The blood in your legs has to travel back to your heart against gravity. This is where the so-called muscle pump plays a crucial role. Every time you walk and actively use the muscles in your feet and calves, you support this return flow. That is why movement is one of the most important factors when it comes to tired legs and venous discomfort. Many conventional shoes squeeze the foot, cushion heavily, and take away part of its natural work. That may feel comfortable at first, but it often means that your foot muscles and natural gait become less active. Your foot is not designed to be passive. It wants to work, move, feel the ground, and stabilize your body with every step. This is exactly where barefoot shoes come in. They give your toes more freedom, allow your foot to roll more naturally, and promote a more direct walking experience. This can help you walk more consciously and use the muscles in your feet and calves more actively. For people with vein problems, this is especially interesting. The shoe itself does not repair the vein, but more natural movement can support circulation and venous return in everyday life. So can barefoot shoes really help? The honest answer is yes, but indirectly. Barefoot shoes do not help as a medical cure. They help as a tool for more natural movement. If they encourage you to walk more actively, cover short distances on foot more often, and stop trapping your feet in stiff shoes, they can make your everyday life noticeably healthier. Especially when walking barefoot or in flexible barefoot shoes, your feet work more intensively. And that activity is exactly what matters if you want to do something good for your legs. Still, one thing is important. If you have severe symptoms, pronounced varicose veins, swelling, pain, or skin changes, you should always have the cause checked by a doctor. Barefoot shoes can support you, but they do not replace diagnosis or treatment. A natural gait is dynamic. Your foot lands, stabilizes, absorbs impact, and pushes the body forward. This activates muscles, tendons, and joints. Your calf muscles in particular are used regularly, and that calf movement is valuable for venous support. In very stiff or heavily cushioned shoes, this natural movement pattern is often reduced. Sole Runner barefoot shoes, on the other hand, are designed to promote more active walking. That does not mean every step is automatically healthier, but it does mean that your body is allowed to do more of the work again, and that is often the decisive difference. Many of our customers tell us that with barefoot shoes, they walk more mindfully, stay active more often, and feel their feet as more alive. This improved body awareness is a major advantage, because when you feel your feet, you usually move more consciously. And conscious movement is a real benefit for your veins, your muscles, and your posture. The right fit is also important. If your legs and feet tend to swell, external pressure can feel especially uncomfortable. A narrow forefoot, hard edges, or a stiff shaft can create even more strain. That is why we offer our Sole Runner barefoot shoes in 3 different widths. Your foot is not forced into an unnatural shape. Instead, it gets the space it needs for healthy movement and natural toe freedom. Especially for sensitive feet, or if conventional shoes quickly become uncomfortable, this can make a noticeable difference. Of course, barefoot shoes are not a miracle cure. If your legs swell frequently, hurt, or change significantly, you need medical clarification. And the transition to barefoot shoes should be gradual. If you have worn stiff or heavily cushioned shoes for many years, your feet and calves need time to adapt. Start with short distances and give your body time. It is not speed that moves you forward, but consistency. Our Sole Runner barefoot shoes are designed to make natural movement possible again. A flexible sole, a flat design without a heel, and plenty of room in the forefoot help your foot do what it is naturally meant to do. For people with tired or heavy legs, this can be a new beginning. Not because the shoe alone changes everything, but because it brings you back to more natural movement, more foot activity, more awareness, and a healthier everyday rhythm. Our Sole Runner barefoot shoes are also sustainably and fairly produced. People who choose natural movement often also think more consciously about materials, manufacturing, and responsibility. So if you ask whether barefoot shoes can help with vein problems, the best answer is this. They can support you because they promote natural movement. And movement is one of the most important factors for active feet, strong calves, and better body awareness. Barefoot shoes do not replace medical treatment, but they can help you create a healthier everyday life. Sole Runner barefoot shoes, like walking barefoot, only better. Thank you for listening and see you next time.